So Dr. Dailey, I know that you were presenting here at the Global Renaissance, and you were presenting actually on out-of-body experience, and I'm actually hoping that you can share with the rest of us what do we need to do to actually have an out-of-body experience.
Well, Nirvana, as I was talking about earlier, relaxation is the key thing. If you just relax and go with the flow. Visualization, you can do things like picture yourself going up an elevator, rising up on a vortex of wind, something that's uplifting. One of the other things that can be useful are some sound technologies we discussed earlier, hemisync, and one called spatial angle modulation. I think these are great tools to help shortcut and make things much easier to experience an out-of-body event.
Okay, and for you, do you mind actually sharing with what your own experience were, at least some of them?
Yes, well, at the Monroe Institute we do a lot of mind consciousness research, and once you experience one it becomes a knowing, not a belief. So, and we would often go out in groups of 20 to 24 at a time, and each of us are in a different, particularly called a check unit, a place you stay and sleep and do these exercises, so you're not adjacent immediately to anybody else. We'd all go out of body, have an experience, come back. Often there was a target question, you know, you're to answer the question in the envelope without actually seeing the question. And then we debrief afterwards, and after we've all submitted our reports, we'd look at them and find a lot of similarities in what a lot of us were experiencing, which is really enlightening, because you wouldn't expect that normally. I had another event where my brother was injured in a pool chemical explosion, and I got a call. It was Halloween night. My wife and I were having a Halloween party, and he was badly burned, third-degree burns of the face and head, and he was blinded in the event. And so I immediately went out of body to see him at the hospital he was located. It was Scottsdale Memorial. He was badly burned. His eyes were swollen shut, so he couldn't physically see. But somehow he was able to perceive that I was there and started screaming to my mother and father at the bedside that Brian's here, Brian's here. And we in fact did communicate. I went back home, it didn't take long, and 15 minutes later the telephone rings. It's my father who, because my brother was so agitated and was saying I was there, and obviously no one else could see it, none of the medical staff or my parents, they sedated him and placed him in restraints temporarily. You know, my dad asked, had I been there, and I said yes. He's on the second floor in the particular bed he was staying in, and there was a very long pause, and I just said, get the restraints off and stop medicating him. And so it was useful.
Well, I would say so. So your work actually helped you keep in touch with your brother at that time. And sorry, just in reference to your work, I know that you're very heavily involved with the Monroe Institute. I was hoping to get a better idea of exactly what type of work and studies are actually being done there. Like, what exactly is the Institute?
There's some really exciting stuff. They have a lot of programs that cover areas to expand your intuition, to assist, although the goal isn't necessarily out-of-body travel, but to assist in doing that. One of the technologies they've worked on developing initially in sound was hemisync, which uses binaural beats to induce relaxation states, different altered levels of consciousness, as well as out-of-body travel. Something more recently that Skip Atwater has been working hard on is spatial angle modulation, or SAM for short.
How was it that you were drawn to this type of work that you do?
Well,
and actually, just to further that as well, I mean, doing the work that you do now, what do you think is to be said about the education today?
Originally, I was doing some research and reading on remote viewing, which I found very interesting. Perceiving distant places, times, events without being physically present there. And I noted that a lot of the military remote viewers trained at the Monroe Institute. So I went there with a skeptical mind and was taken in by the magic. It was a wonderful place, and Skip Atwater teaches a course in remote viewing with Paul Elder that's just one of the best in the world. and wound up taking multiple other programs, getting involved with their professional division and their research group and their remote healing group. When I look at education, when I was in medical school, there were no complementary medicine courses. It didn't exist back then, but it's been steadily growing, and you'll find places like Andy Weil in Tucson, Arizona, have had a program for quite some time, but the other schools are starting to catch up, and I, as a clinical instructor in complementary medicine at the University of Rochester, I've had the opportunity to teach and share some of the things I've been doing with medical students, and actually all the medical students that rotate with me get the Reiki 1 and Reiki 2 certification. I actually had one recently that came from the Southwest to spend several weeks with me, and a great learning experience. And it's hopefully in the not too distant future we'll be seeing more of these things taught at earlier ages, you know, right in the undergraduate and also in primary schools.
So actually doing the work that you do, what are you hoping to accomplish with it?
Making people feel better. That's my ultimate goal.
So do you have any, I guess, preference in terms of techniques, treatments?
Well, I like a lot of the energy therapies. They're very gentle. Patients seem to really enjoy them. And I'll use a combination. I have a wonderful hydroelectrostatic massage table, fully adjustable, and we have a 750 watt 5-channel surround sound system for our HemiSync and NSAM, and you know, we use crystals at the same time. Patients really seem to enjoy them. They're not necessary, but a lot of people like them. And Reiki I like, not because it's the best energy therapy, but it's very easy and quick to learn, 1 or 2 days. And if you've just been diagnosed with breast cancer and you're starting chemotherapy in 3 days, you don't have a lot of time or a year to master Qigong or Tai Chi and some of the other wonderful therapies that are very helpful as well.
Dr. Dailey, what did you think about the entire Global Renaissance event today and basically the work that's happening from Seventh Dimension Health?
I think it's absolutely fabulous. This is one of the most professionally run conferences I've ever attended, and the speakers were great. Asad Mekki, master hypnotherapist, really was impressive, and he did a session with us to help us lose weight, and right immediately after, they served these delicious cakes, and I walked up and I kept reaching and reaching, but I couldn't pick it up. I couldn't understand why. As I'm leaving, I thought, dang it, it worked. And to hear Dr. Swami Ajaya speak on consciousness was just a great talk. So hearing these and I was looking, Jonathan Goldman's here in June, wonderful sound healer. I'm a big fan of his. Really some top-notch people here.